My question is concerning children and adolescents through age 18 with positive group A streptococcal pharyngitis. Is a shorter course of non-penicillin antibiotic more effective in resolution of infection compared to the recommended 10-day penicillin course? My patient was a 14-year-old Hispanic male who presented with his mother to the clinic complaining of fever, sore throat, and headache for one day. He was sent home from school yesterday with a sore throat and feeling ill. Today he complains of 9 out of 10 in severity of sore throat and feeling hot and finding it painful to swallow. He had missed his 6 contacts at school, but he's not sure what they have. Past medical history is significant for ADHD and a positive group A strep in August of 2015 for which he received amoxicillin. He's up to date on his immunizations. Review of systems revealed fever, decreased appetite, fatigue, sore throat, and headache. On physical exam, the patient appeared ill. His oral temperature was 100.8, and his posterior pharynx was erythematous. He had tonsillar exudates bilaterally, and his neck revealed bilateral anterior cervical lymphadenopathy, which was tender. The rest of the physical exam was unremarkable. His rapid antigen strep test was positive, and monospot was negative. Based on the Centaur criteria, which is typically used to guide clinical decision-making when treating the acute sore throat, the patient met 5 out of 5 criteria. In addition to the positive rapid strep test, he was diagnosed with acute group A streptococcal pharyngitis, and antibiotic therapy was initiated. The article that I found, which best supported my PICO question, was a Cochrane systematic review, which looked at 20 studies and approximately 13,102 cases of strep. Strep had to either be diagnosed with rapid strep test or positive throat culture, not just clinical findings alone. The aim and objective was to compare 2 to 6 days treatment of non-penicillin antibiotic compared to the 10-day treatment in resolving group A strep. They looked at the duration of treatment, or duration of symptoms, eradication of the organisms, recurrence, and complication rates. The randomized controlled trials were the only studies that were included in the systematic review, and the participants were age 1 to 18. The findings were that the shorter duration treatments had a shorter period of symptoms such as the fever and sore throat. However, they were not more effective in treating strep throat. They had higher incidence of side effects such as mild to moderate vomiting, diarrhea, and abdominal pain, and long-term complications such as rheumatic fever and acute glomerulonephritis was not studied during this. The treating group A strep is something that we will commonly encounter in the primary care practice, and it's important to know that you do have options when choosing antibiotics, especially for patients who may not adhere to medication therapy effectively. So knowing that we do have options that are equally as effective as penicillin will be important moving forward as our practice as physician assistants in treating the acute sore throat. Thank you.